There we go, the panel discussion. This is about the AI and digital transformation to mitigate COVID-19 and future pandemics. And our main question to the panelists is going to be, what did you learn in these 2 years that surprised you? What did you find something other than what you expected, and how does it impact the way you think about the future, and specifically about the use of AI and the digital transformation to actually prepare for pandemics, treat them, prevent them, et cetera. Okay? So emphasizing what did you learn. Okay, so introduce the panelists. Nancy Amato, who is my boss, one could say. She's the department head. She is a winner of many awards. Among them, probably the one that I like the best is the Nico Haberman Award, which if you don't know it, look it up. It's very nice. She works on robotics and motion planning. She also works in computational biology. That's what she was funded for, the DTI project, mining diagnostic sequences for SARS-CoV-2 using variation-aware graph-based machine learning approaches. Okay, the next. John Burge from the University of Chicago, operations management, and has been doing a lot of interesting modeling. And his work is on can targeted closures reduce economic loss and control COVID-19 spread? So note that this is economics. This is now policy, and it's bringing in a different perspective. The next is, oh, you're out of order. Peter Hepburn on the end. So sociology at Rutgers University. He's examining how changes to 3 core social institutions, which is to say work, criminal justice, and housing, serve to produce and perpetuate inequality. And this was a project that was funded by C3AI DTI for housing precarity, eviction, and inequality in the wake of COVID-19. And we all saw how incredibly important that became. And then in the middle, Stefano Bertozzi, former dean, UC Berkeley School of Public Health, has been working all around the world on important questions, again, involving now public health, impact on economics, et cetera. His project was using data science to understand the heterogeneity of SARS-CoV-2 transmission and COVID-19 clinical presentation in Mexico. So again, an international perspective. This group has a bunch of people doing different kinds of things. And we can go to the first question again that I posed, and with some perspectives on the bottom, which you can't read. But what did you learn? Think about whatever it is that is of interest to you. Think about data, think about public policy, think about mathematical modeling. How does AI fit into that? Can it improve things? Whatever you want to talk about. And I'm just going to start with Nancy.
Okay, well, thank you, Tandy. What I learned, I guess one thing I learned, which in retrospect shouldn't have been too much of a surprise, was that we can't do any of these things that we want to do without good data. And the data that we were hoping we'd have access to did not have all the information we needed. And so, for example, we were trying to look for low-frequency events in the data. And for that, we needed to have, a lot of the metadata, where even if they would give us some data, information out of a sample, we might have known like where it came from, but we didn't know when it was gathered. We didn't know, they had a lot of personal information about the subjects, which was not available in the public data sets. And so we spent a lot of time, trying to reverse engineer some of these things based on that. The other thing is the submissions to the data sets, people really were trying. I think people were trying to make data available because they knew how important it was. But we don't have the proper mechanisms to really share that in a proper way. And then there would also be certain sites that would make much bigger deposits than other sites, and that was also skewing the information. And that was actually something that we really kind of did not realize until later on, because we were finding all these surprising things when we were looking at the data. And then we realized, well, it's because 80% of that came from the UK. or something. So these things really prevented us from being able to come up with timely and important, information. And the other thing is, I think that we really do need these things for a pandemic because things are also very local. Things do not happen at the same time in the same way everywhere. And so we really do need to solve that problem.
Great. Okay, Stefano.
Well, thanks, Tandy. Thanks for inviting me. Nancy, you stole most of my thunder because
I'm sorry.
I in a good way, because I think that's really, for me, the biggest lesson. I mean, the good thing is that I'm very optimistic for the next pandemic because I don't think we could have done worse the next time, because I think we kind of showed what the bottom is, right? And I think that when we think about pandemic preparedness going forward, and we think about data and analytics, we can spool up analytics pretty quickly. We can't spool up the mechanisms to get access to data quickly. At least, certainly that's been the experience this time, right? So just as an example, I mean, this isn't the data example, but it's the sort of trial example. We knew from before we had a pandemic that if we ever were to have one, we would want to figure out which vaccines work quickly, right? Once we had a pandemic, we knew that a bunch of people were creating vaccines, which meant that we knew that we would have to have clinical trials, right? So at what point does it make sense to think about a mechanism for having multiple large-scale clinical trials that are coordinated, so they use common controls and things like that? That's the kind of preparation that needs to happen in advance. So thinking about the next pandemic, you're looking at sequences. Well, wouldn't it make sense, since in every single community in this country and around the world, sewage systems are public domain, right? Shouldn't we have a consolidated, uniform system where we can sample sewage systems? And we would know, not have CDC guess as to what the proportion of the Omicron variant that's BA2 is right now. We could know real time across the country very easily. Now, that's the kind of thing that has to be done in advance, right? And I think that we've learned catastrophically. Now, this country, thank God for the UK and Israel and other places with large integrated health systems, because our biggest one is Kaiser, and that's 11 million people out of 300 million, right? So we don't have the ability to do, but we have 1 million physicians approximately. We have 5 million nurses approximately. That's 6 million people who would sign up tomorrow to a countrywide, relatively representative in terms of communities, pool of people that you could use for clinical trials, you could use for tracking. So huge problem in our data is that most people don't get tested, right? We don't know what proportion are asymptomatic. We need prospective cohorts for that. That kind of stuff needs to be set up in advance so that it can be triggered when something like this happens.
Wonderful. I'm going to have a question for you afterwards, but John, you're next.
Yeah, thanks. I also want to thank everyone for sticking around, for waiting until the very end. So thank you for being here, and thank the organizers for inviting me. I didn't know much about epidemiological models before this, and I've learned a lot about them. But one thing I wouldn't have known is how bad they were. I just had no clue. And it's not so much that they're bad about prediction, but they're incredibly bad in terms of uncertainty quantification. If you look at an article that John Ioannidis and Martin Tanner, my former colleague at Northwestern, wrote, it was absolutely horrendous. For people making predictions and giving prediction intervals that were orders of magnitude off over a very short period of time, over 48 hours, for example. That really made me think, wow, we have to really look back at this and rethink the way things are being done. But the other thing I'm learning is that people are really wedded to their prior thinking and have really based much of their thinking on having strong priors that don't seem to be updating very well through this pandemic, even though we seem to have gone through a lot with it. So it makes me think that uncertainty quantification and thinking about things that are extensive beyond the model that you've already created, I think is something that we as a community need to think about more. The other thing, I'll just mention one thing in terms of policy. At the beginning of the epidemic, I I have an engineering background, and I tend to think as a systems analyst. That's the way I was kind of raised. And I think it's an entire system, so we have to look at everything about that system. So any kind of intervention, any kind of treatment, we should look at the entire system. And if a treatment involves things like restricting people from work, discouraging them from going to the hospital, discouraging them from getting treatments, that's probably going to have a large health effect that's going to be independent from any individual disease. And that large health effect could have great consequences. And I wrote an article with Scott Atlas, Alex Lipton, and Ralph Keeney about that, that actually at the beginning, that we're going to see mortality spike because of this, not because of COVID. And that's mortality that's going to be within the working age population because they're the people that are going to be most affected. And it's the people that are at the lower end of in terms of income of the working age population that are going to be most affected. And I thought, well, everybody's going to recognize this. Everybody's going to obviously know that, and that's going to guide policy. No, it did not guide policy. And we've kind of seen the effects of it, and you can look at the record. The record kind of, unfortunately, bears out what we had predicted. So I was just surprised that systems thinking is not generic. And I think that's another thing that maybe we can try to bring to the world, to think more systematically, think about overall goals, think about overall health, not just a single disease, but about the overall health of the population. And hopefully we'll learn, but so far I'm not too optimistic.
Okay. Peter.
Thanks, and thank you for having me here. Thinking about what I found surprising in responding to the pandemic, I think, really going back to Nancy's point, just how much we don't know about the questions that are really important to sociologists, to policymakers, as we try to confront a pandemic has been striking. And so to take an example based on the work that we've done, we knew in the early days of the pandemic that millions of people were getting laid off. The people were losing their jobs, and that those people were disproportionately in the service sector, in the retail sector. And these are people who are living paycheck to paycheck under normal circumstances, who don't have a lot of savings, and who are more likely than not renters rather than homeowners. And we knew that there was going to be a real crisis once you hit the 1st of April or the 1st of May and people being able to pay rent, and this possibility of this huge surge in eviction cases. And if you have a highly communicable respiratory virus and you're trying to encourage physical distancing, you don't want people to be doubled up in housing. You don't want them to be in homeless shelters. And we want to do everything possible to keep them safely housed. And the reality is we just don't know how many eviction cases are being processed at any given time in the US. Like, the way that we collect housing data in this country are such that we get that information 2 or 3 years later. And we don't want to wait until 2023 to find out what's happening in the second quarter of 2020, right? And so what we've been doing is, we built this infrastructure to collect those data from jurisdictions around the country, and we built a platform to share those data, to disseminate them to journalists, to advocates, to policymakers, from the local level up to the federal level, so that they could understand what their communities need and who is at risk of losing their homes, and try to target interventions. And I think relative to a lot of the people here at this conference, we're not using, the kind of technical skills that we're using are rudimentary, right? There's not much AI in what we're doing. But just the basics of data collection are just so important, and making that data, collecting those data, making them available, and trying to figure out how best to work with them, I think is critically important and really sets us up for the next pandemic.
So let me just say that what I've heard from the 4 of you is that data are an issue, quality of data, access, even knowing what questions you want to ask, so therefore what data you need. So data are an issue. The mathematical models are inadequate, and they have these huge confidence intervals. And then also the importance of informing policy. So what I want to see, can any of you try to connect, like data is the basis perhaps for the models. Maybe the models can be improved through better data. Instead of working with abstract models, is there a way to bring what we know, especially the data that we're assembling, to be able to get better predictive models? That's one basic question. And of course, AI is interested in predictive modeling. So how do we make these predictive models work? Another question is, how do we make the case, or do we want to make the case that AI should have a role in public policy? So those are two questions. Whoever wants to say something or answer a different question.
I'll start. Yeah, I mean, I think having data and having data, again, it has to be safe. To have data that people can access so that people can use it. And I think we need to think hard about, particularly for health data, which it brings up a lot of privacy concerns. Yeah, I think having that data available allows us to ask different questions. And I think we need to be able to be very transparent. I think a lot of what has gone on, because people are, I think, sometimes protective of, they're protective of their data, but also protective of their models, that they're not as willing to allow others to inspect their data. I also do some work in pharmacovigilance. In that pharmacovigilance, we really need to have opportunities to be able to inspect afterwards and to be able to do it independently. To not be able to do that now, for example, unblinding a study in the middle of a study before we've actually collected all the data is not a really great idea. It's going to make it very difficult for us. We need ways in which we can collect data in an independent manner so that we can actually do these ex post studies. I am hopeful that we'll be able to do something with that now, but we need to have that kind of transparency to do it.
Nancy, you're going to add to this?
I totally agree. There are, like, you brought up, like, wastewater. There are sources which we are not, exploiting, which we need to, right? And that can also help us, if we have, some source of data that we can count on and we can share and it's available, that then could have, if we had something like that, we could have used that to also gain some confidence or learn something about the data that we did have. Thinking also about the data for, like, evictions and things like that, this also has privacy issues, right?
Yeah.
So I'm not sure that people have thought about that as much as they have about health data.
Yeah, no, absolutely. I mean, that's absolutely a serious concern in doing any research in this field. These are public records, and so they are accessible, and there are, of course, also private actors who are collecting these data and then use them to provide landlord screening services, tenant screening services to landlords. So these are already being sort of collected and monetized in their own way, but they're not being used by the research community.
Exactly.
At all.
So I was thinking also, data is collected all the time by, like, our credit card companies,
Right.
and
Yeah.
those things are sold all the time, but they're not available to us.
Right.
Right. So I think maybe that's a big, disconnect.
So can someone try to bring this back to DTI? Which is to say, we've been talking a lot about the practical challenges of doing the work we want to do, how the data is impeding our success. But can we connect it back to AI? And to big data, Internet of Things, the vision of digital transformation? And again, I would still like to hear, can we use AI to inform public policy? Is that a safe thing to do? What are the limitations for that? And so see if you can connect it back to this organization.
Sure. I'll take a shot.
Okay.
So, I'm thinking about one of the major policy responses in terms of the pandemic and housing has been the Emergency Rental Assistance Program, right? So Congress allocated $46.5 billion to pay people's back rent and to try to keep them housed. And this is more than the annual budget of HUD. It's an unprecedented amount of money that's being pushed out to try to keep people housed. And you could think about a world in which we were able to use better data and better models to target that money really directly to the communities that need it most, down to the buildings that are at greatest risk, and the tenants who have lost work and who need help. And that's like a potentially a great way to be able to target that aid. The way that the money was distributed was based on state population. So that means that they didn't even take into account that some states have proportionally more renters than others. That in some states, the rent is more expensive. It's more expensive to rent in New York than it is in Utah, right? There's a lot of data that's already available that could have helped to better distribute that money and to create better policy. And that data was ignored, right? Yep. That just never factored into the equation. And I think it's encouraging to think about how AI could help us to make better decisions.
Right.
But you need to convince the people in the positions of authority to be willing to cede the power to make those decisions.
Yeah, I'm just going to add that there's a big direction in AI about algorithmic fairness. Mm-hmm. And a lot of what you're saying right now is going to be, how do we do this in a way that is actually okay, that is kosher? So Nancy, you're like the most AI person here. Speak up.
No, that's totally in line. I was also kind of reminded of the discussions this morning where we were thinking about, nobody is going to want to ask, your algorithm to make, firm decisions, but to flag, situations, raise things that need further inspection. That absolutely, even with bad data, we can do that, right? And I think there's a huge role for that. But again, data is the foundation.
Okay, so
if we do not have that, we can't do any of these things.
Okay, so what's coming out of this panel is data and preparing for how do we access the data, how do we create the data, how do we make sure we're ready to be
and timely too. I mean, this 3-year thing, that was shocked to hear that, frankly.
Okay, so this is something that definitely came out of this panel. Before we turn it out to the audience, is there any other main point that any of you want to make?
Well, I was just thinking that when you were talking about these various issues, it depends on what phase you're in, right? So if we think now to the next pandemic, what we're really interested in is early detection, right? We want to prevent a pandemic from a small epidemic, right? So you have things like network-linked thermometers, which are now increasingly prevalent, where you have Google searches for fever or things like that where you can identify potential outbreaks. That's very different from when we're talking about housing insecurity, when we have a massive epidemic in a particular location. So I think that we also need to think about the temporality of those things. Mm. You mentioned fairness. Fairness is incredibly important at the level of the individual patient, right? A manuscript I saw on Friday looked at severity scores and predictive algorithms for ICU patients, which are unsurprisingly biased against Black people in this country. But I think that at the population level, if we're looking for a new outbreak or something, the biases are going to be much less important. So also figuring out where we direct our anti-bias efforts, both in the phase of the epidemic and the types of data that we're looking at is going to be really important.
And of course, privacy. Suddenly, privacy becomes an issue.
Yeah, I just wanted to pick up that it's not just collecting data, but we have to do it in a way that is unbiased.
Yes.
And that takes planning. You can't have sort of a reactive system and assume it will be unbiased. It will be biased in some way. And I think we've seen a lot of effects from that.
Which argues for prospective cohorts, longitudinal cohorts,
longitudinal
standing ones that you can activate.
That you can activate.
Yeah, absolutely.
And you also need to be able to quantify the bias, because we're not going to be able to really remove it.
Right.
But you could, mitigate the consequences if you do understand the bias.
Yeah.
So I'd like to open it to the questions to the audience, if you'd like to ask someone here. Shrikant.
Prashant.
Hi.
Oh, can't.
At least there's one health policy expert on there, and then anybody can jump in as well. So one of the questions I had was about messaging. What did we learn about messaging in this pandemic? So there is one side of it which is about using AI models and stuff like that, and predicting, and we can make that better. But then there is another side to it, which is a lot of people were very opposed to closing anything, and their argument was in terms of economics and business and so on. And the question I have is that what have we learned from this pandemic, where there's an AI side to it, and then there is sort of a social side to it, which is mixed between politics and business. And so how would we handle this in the future?
Who wants to go first?
I'm not going to answer that so much, but I will tell you a little bit. If you look in Google Trends, if you look at statistics, so if you take statistics in the end of 2019, it was pretty low, and then spiked up at the beginning of the epidemic, like lots of people searching for statistics at the beginning of the epidemic, and then it's gone down, and now it's below where it was in 2019. If you look at analytics sort of went up and then very sharply down, and it's like down far below where it was before. So in terms of messaging to the public has lost a lot of trust. So I think the epidemic has actually made the public think that these scientists, these AI people, they don't know what they're doing. And so we should not trust them. And we not trust them for this epidemic, but not trust them in general. And that's I think, really one of the biggest dangers I see.
That's a very sad answer. Yeah.
Thank you. Very inspiring panel. So I wanted to pick up on something, Stefano, you said about predicting the next epidemic. We are in the middle of an epidemic, and it's one of the most pressing problem with regards to forecast is to pick these turning points. So when is the next wave going to begin? So for example, there's BA.2 variant, which we know is a dominant strain, but nobody can say with certainty that whether US is going to have a wave or which will be the hotspots, et cetera, right? So my question to you is, what is missing with regards to data/modeling, which will help us become better with that? There's a lot of work that has happened the last 2 years, but what do you think are some of the sort of open directions, if you will, right? Something that would make us even predict whether something like BA.2 is going to take off and lead to the kind of cases. Here, India is different, right? India, there's a paper out recently which says that July and August is going to be a big wave. It's controversial.
Well, I would like to pick up on one thing that John said, which is the need for unbiased data, right? 5 members of my faculty have been infected with COVID in the last 2 weeks. None of them are in the data because none of them were reported because all of them were self-diagnosed with home tests, right? So the question of how much of a surge are we really seeing now with BA.2 is confounded by the fact that we have had a massive increase in availability of home testing. So we see New York trending up now. We see California in the sewage system trending up now, but not yet in the data. So this issue of having unbiased data, I think, is part of an answer to that question, right? I think that we want to do a much better job of identifying things early so that we can take appropriate precautions. And we're not good at that. And especially with zoonotic infections that move from animals to people, that tends to happen in places without great surveillance infrastructure. So as a globe, we need to invest in better data systems. And I was involved in some economic analysis of a project that was trying to characterize the viruses in the animals. And my response was, characterize the ones that we know already jump to people, even if they don't yet transmit from person to person. But we want a global warning system of where viruses from animals jump to people, even if it's just a one-off infection, because the next mutation may contribute to person-to-person transmission, right? But having an early warning system is clearly something that we've learned from this one. We want to have a better handle on. I mean, we could keep going, but I think that that's a sense of the future. I think we also, when I think of the next pandemic, it could be pi, if that's what the next variant's going to be called, right? I think of the question of the next variant as being the equivalent of the next pandemic, because it may well behave that way if it escapes our current vaccines or natural immunity.
Can we take one more question? Is that okay? Okay, last question. Hold on.
I want to follow up on what John said about system level versus subsystem level issues. I think it'll be nice to look at this pandemic and perhaps previous pandemics and look at what characteristics in people's lives, whether it was personal lifestyle, what they ate, what the air quality was, where they lived, how much stress they were in, etc. How much those characteristics, to what extent are they related to their amenability to the virus? Okay, because we had it, pandemic. We didn't want to have it, but we had it. So now we have this data. And can we come up with a correlation between lifestyles of people and their susceptibility to the virus? This is motivated by the belief that, or the presumption that our bodies are meant to not be affected by these viruses. The reason we are more susceptible is because there are some deviations or some ways of life that make us more susceptible. So it's a system level issue, not just, okay, there is the virus, find a drug to kill it. That's one way of doing it, but not catch it in the first place.
Well, I was going to say that's another thing where we need to do a better job in data, in that we tend to measure things we can, right? So we tend to just focus on those things. People use race. Do we really know what race means? I don't. I can't define it. But it seems like that's something that's identifiable and people put it down. We use certain things only because we can measure it, or we think we can measure it, and even though it's not really, even that is not something you can definitely measure. I think we need to think about broader issues like behavior, that other things that are not as easy to measure, but that perhaps by creatively thinking, we can think about other ways in which we can somehow get at behavior in terms of the measurements that we make.
Well, thank you very much for being here. I want to thank Nancy, Stefano, John, and Peter, and all of you for your questions. I think we have a break, and then we have a poster session, right? And then we have a networking event. Is that right, Shrikant?
We can leave.
Okay.
So this is our last session in this room, but the conference is not over. The symposium is not over. There is a poster session, and I think the students and the postdocs would be very grateful if you show up there and look at their posters. But I also, since this is the last time I have the podium, I want to thank everybody for attending the symposium. And I want to thank a couple of people in particular. I think the real chairs of the conference were Larry Rohrbaugh and Jay Roloff. Can you please stand up and